Hi, my name is Ellen Herman. I'm the Administrative Director of Watkins Health Services. Here at Watkins, we offer a full spectrum of primary care services to the students at the University of Kansas. Visits with our medical providers are included in the student health fee that the students pay, but there are charges for other services we do in our clinic that are billed to the student or their insurance. Last year, I started hearing some comments from some of our providers that some of their patients were having to choose between healthcare and food. Here at Watkins, we never want a student to have to make the choice between healthcare and food or other necessities. And that was one of the reasons for the Patient Assistance Fund.
My name is January Coker. I am a current sophomore at the University of Kansas with a major in sports management and pre-athletic training with a minor in business.
The students who are eligible for the Patient Assistance Fund are those who have paid their required campus fees and are eligible for services at Watkins. The students just need to fill out a simple form, and it goes to our social worker, who will then give them a call to see if they need access to other services. Then they can receive up to $50 a semester of assistance. The funds can be used for any of the services that we provide here inside the building. Those could include prescriptions, labs, x-rays, CAPS therapy visits, and procedures that students would have here in our building.
The funds helped me definitely with figuring out what issues that we should attack first. I do take a lot of medication, and that was one thing I was concerned about.
We know in healthcare that most medical bills are unplanned and unexpected, so we wanted to form this fund to help students with those unexpected expenses, and I think it helps the students focus more on their studies rather than on any bills that they may have.
Once I was able to be on those meds consistently, I was able to have a clear mind and felt like all my days could be so much happier.
When we first started the fund back in February of 2022, it started off kind of slow with relatively few requests for funding, but as the year went on and the word got out and times just got harder for students, we started getting more and more requests for help. And during the month of October of this year, we've already had 3 times more requests for funding than we have any other month.
I started at 104.
In order to keep the Patient Assistance Fund sustainable over time, we need to continue to receive donations. So please consider donating if you're able. We thank you, and the students at the University of Kansas thank you.
It is important to keep this funding going to help students just like me.